The aim of the project is to reduce the anticholinergic burden. We have a lot of patients who come in with a significant amount of medications. It's not uncommon to see patients with over 8, even 10 medications when they come in.
We all know that sedatives and anticholinergic medications are not good for older people. In most cases, these medications cause falls, increases mortality, and increases the risk of readmission. So what drug burden index does, it calculates that risk in a quantifiable manner. And then in that way, clinicians like myself, medical officers, nurses, we can look at that and then say, oh, this person is a high risk or low risk.
It's much easier for any nurse on the ward if they can look at the drug burden index in EMR and refer a patient to the pharmacist, especially if a patient's a high falls risk. When a patient comes into hospital, we do a falls prevention plan. We can make that part of the plan that we ask the pharmacist to review the drug burden index.
After we implemented this referral pathway, we observed that more than 80% of the patients who were referred needed a review pretty much straight away, and more than 75% of patients had their drug burden index reduced. We don't believe that this has been tried before, and that's what makes it a really innovative project, in that we are using expertise of both nursing and pharmacy and medical staff to ensure we give the best possible medication outcome for our patients.
The Improving Pathways project originated in the attempt to reduce the waiting list for the Wyong paediatric unit, and the identification that some of the children waiting to see a paediatrician could be seen and assessed by a child and family health nurse that had the skills and the qualifications to do that.
The aim of the project was to engage children aged 0 to 5 with early access to care for simple childhood presentations. So children that might have a problem with feeding or who might be slightly delayed with any of their milestones. Well, the goal was to try and bring them in early, engage them with early access to assessment with child and family health nurses, and offer them an opportunity to be referred to relevant services if it was required, such as allied health or dental or other services that we could offer.
The outcomes from the project are that the waitlist has been reduced. This project has made a positive difference to the families of the coast, and it actually aligns with the CCLHD priority goals in the timely access to care and the access to high quality, safe patient care. So it's a win-win.
I think the project team is most proud of, firstly, the collaboration between our two services, and then the impact that it's had on our families. So I've talked to the child and family health nurses who are the front face of this project, and the families are really happy. Being nominated for this award really shows how valuable the project has been, and to really value how significant it is to come together as a team and collaborate, remove any of the red tape that it means to come across and help each other for the pure same focus of being there for our patients.
The project was about preventing falls on K8. We'd had an increase in our number of falls within the unit, and we wanted to focus on reducing those numbers, and in particular reducing harm to our patients. The initial strategy was to really increase our awareness of falls prevention. We were pretty good at the time, but we had had an increased number of falls, so we needed to, I think, raise our awareness even further, particularly in our prevention strategies. Stacey had formally identified some patient behaviours related to falls, particularly with bathroom and toileting activities. And so we were able to identify that that was the more common place where falls were occurring, the more common activity for falls, and isolate some times of the day where falls were a bit more prevalent as well.
As a result of the project, falls have reduced by 70% over a 12-month period on K8. We've also managed to reduce our significant harm from falls to 0.
That's impacted the district in many ways. I think obviously length of stays, patient harm, patient satisfaction, family satisfaction, staff satisfaction as well, and that we've reduced those numbers significantly.
For the team to be recognised for this award, it's validation of what we've done and all of the hard work that we've put in, not just us as a project team, but the whole K8 team, and the effort that they've put into implementing these changes and making them successful.